Good evening, everyone, and welcome to tonight's webinar, Mental Health Support for Aged Care Residents During COVID-19. My name is Kiara Beans, and on behalf of GPEx and Country SAPHN, I'm excited to offer this second webinar in our three-part series with Jane Calligeros. Jane is the owner and lead consultant at CDM Plus, whom provide training and resources for primary healthcare, community and aged care. Jane has an extensive background in nursing, has been working in general practice for the past 7 years and holds postgraduate qualifications in chronic disease management. I would like to acknowledge that we are hosting this webinar from the lands of the traditional custodians. I acknowledge the traditional custodians of the various lands on which you all work today, and the Aboriginal and Torres Strait Islander people participating in this webinar. We will have a short Q&A session at the end of Jane's presentation. However, please feel free to utilise the chat option at the bottom of your screen throughout the webinar, and Jane and I will endeavour to get to you all. Thank you, and over to you, Jane.
So we're going to have a look at some of the reports that have led to the current changes now available, including the Royal Commission into Aged Care Quality and Safety, the final report, the Aged Care and COVID-19, a special report and progress report, and then the National COVID-19 Aged Care Plan. So I've got the agenda there. We're going to look at the impact that COVID-19 has had on aged care, and then those current initiatives that are now available to better support the residents. So in tonight's session, we're going to look at aged care and mental health, what's included in that Better Access initiative, what diagnosed mental disorders are included, and then how residents can access mental health support, and then what's required from the mental health professionals in regards to like what plans, the reviews and the referral requirements. We're going to have a look at the claiming and restrictions, and then an overview of those temporary MBS numbers for the practitioners that are delivering psychological services. And then, as Kiara said, if we've got time at the end to go through some of the questions, if anyone has any, just to pop them in the chat as we go. So mental health and aged care. So the Australian government has expanded the eligibility for the Better Access to psychiatrists, psychologists and general practitioners through the Medicare Benefit Schedule or Better Access initiative for aged care residents. So part of this measure was in response to the Royal Commission into Aged Care Quality and Safety, the COVID-19 Special Report recommendations. So this measure will allow general practitioners, psychologists, occupational therapists and social workers to provide psychological services to aged care residents in a COVID-safe way. So there are fact sheets available, and all of those resources we do have at the end for you to be able to access as well. So the MBS subsidised services under that Better Access to psychiatrists, psychologists and general practitioners through that Better Access initiative are available for patients with a mental disorder to receive up to 10 individual and 10 group allied mental health services per calendar year. So in August 2020, the Better Access initiative was expanded to provide 10 additional MBS subsidised individual psychological therapy sessions for patients in areas, especially around the lockdown restrictions during the pandemic. So mental health and COVID. The cost of mental health, or the cost of mental ill health on Australia's economy, it's up to something like 220 billion each year. And there's many types of mental health conditions and disorders. So I'm just going to mention a couple of the most common. So anxiety, affective disorders, including depression, substance use disorders, including alcohol use. So it's just from one of the reports from the Australian Institute of Health and Welfare, so 7.3 million people will face mental ill health. So good mental health, it's a key factor associated with healthy ageing, and it's determined by a combination of factors. Just going to move across. So with some of the impacts of COVID-19, physical distancing and isolation, it can just add some added anxiety and stress to some of the residents and people outside the aged care facilities. So the government's supporting people's mental health during the pandemic, and there's a full list in one of the fact sheets of those additional services available, including additional funding provided to the primary health networks. There was a dedicated coronavirus mental health wellbeing support services through Beyond Blue, Lifeline, Kids Helpline, and then those Medicare subsidised psychological therapy sessions. So there's a full list there on that fact sheet, and we've got the link for that on that slide and then at the end of the resources as well. Mental health providers. So the Australian Institute of Health and Welfare, it's got like another report there. So this one was, the figure up on the slide is just the Medicare subsidised services for mental health for people aged 65 and over by the type of provider. Okay, so you can see there 2016-17, people aged over 65 received almost 1 million Medicare subsidised mental health related services. So these services represented 9% of the total 11 million mental health related services subsidised by Medicare in that year. So GPs, psychologists and psychiatrists provided a similar proportion of the mental health related services received by people 65 and over. This one with aged care and mental health. So Gen Aged Care data, it's got some great reports and data if you haven't been on there to have a look. This one's 87% of people in residential aged care were diagnosed with at least one mental health or behavioural condition. So this particular report or snapshot that we're looking at was from the 30th of June 2019. Showed that almost 99.7% had a current ACFI assessment on their record. 1/3 had high care need rating, and then 2/3 had high care need rating in the cognition and behaviour assessment areas. So, as I said, the majority were diagnosed with at least one mental health or behavioural condition, and then almost half, so 49% of people in permanent residential aged care had a diagnosis of depression. And then just over half, so 53% of people in permanent residential aged care had a diagnosis of dementia. So we're going to have a look at one of the reports. So if you haven't seen this one yet, this is the aged care and COVID-19 special report. And it had a list of 6 recommendations. So I'm just going to have a look at one of those on the next slide. This next report was the progress report against those recommendations. So where these initiatives and additional temporary items came from was part of these recommendations in the report. So this one, recommendation 3, was that the Australian government should urgently create the Medicare benefit schedule items to increase the provision of allied health services, including mental health services, to people in aged care during the pandemic. Any barriers, whether real or perceived, to allied health professionals being able to enter residential aged care facilities should be removed unless justified on genuine public health grounds. So in this progress report, so the Australian government had accepted that recommendation and they created those additional item numbers for the mental health and allied health services for residential aged care facility residents. So in addition to the measures recommended by the Royal Commission, the Australian government also provided 15.7 million for primary health networks to provide in-reach group reablement programs. So in those new measures, and what we're going to talk about this evening is some of those mental health services, and then in tomorrow night's in the next webinar, we're actually going to look at the allied health services. So with the mental health services, the Australian government introduced a range of measures to support the mental health of residents of aged care facilities over the course of the pandemic, including a $12.4 million support package for recipients and their families through the grief and trauma response package. In addition, there was an additional like $19 million to enable the PHNs to commission those mental health services, and another $10 million as part of the community visitors scheme. So the link there will take you to some of those additional reports and further reading on funding if you wanted to have a look at those as well. So as we said, tonight we're going to look at the mental health services, and then the third webinar we're actually going to look at the allied health services. So it actually takes a combination of the first webinar and the second webinar, plus some of the additional allied health support. So the third session that we're going to look at with allied health services is increasing allied health for residents of aged care facilities, which will improve access to the services and incentives to allow the allied health professionals to actually deliver those services to residents. So there was also additional allied health group services for the care residents in facilities affected by COVID-19, and provide that funding to the PHNs as well. So the whole, I guess, idea and the reasoning behind this is to actually improve the residents' physical and mental health, to address the things like deconditioning that have been caused by isolation, and provide the psychological therapy services to the people who will benefit from that structured approach for the mental disorders treatment. So the measures provide additional mental and physical therapies by the allied health professionals, and that's what we're going to look at in session 3. And then the other allied health is around the additional services for psychologists, social workers, occupational therapists, physios and EPs. So part of the mental health services, just as an overview, so that expanded better access to psychiatrists, psychologists and general practitioners through that Better Access initiative is actually going to allow aged care residents to access up to 20 individual psychological therapy sessions. So that was at a cost of an additional $35.5 million as well. So in the National COVID-19 Aged Care Plan, it speaks about COVID-19 related deconditioning of the older people. So evidence had emerged from the COVID-19 experience that a lot of the residents that couldn't access regular health services and other older people were choosing not to access service to minimise the risk of exposure to COVID-19. And I think we're still seeing some of the impacts of that even now. So they were having increasingly worse clinical outcomes. So some of the main contributing factors to deconditioning are psychological, nutritional and physical. So allied health has a really big role in the prevention of the decline in patients in the residents' condition. For Aboriginal and Torres Strait Islander peoples, there's the holistic view of health and the provision of the culturally safe care. It's also really important as well. And then delivering the person-centred care for residents. So all of that is in the COVID-19 Aged Care Plan, the updated version. So there's a few fact sheets available as well. So there's one particular on the Better Access initiative. So the Better Access, as we said, as part of the government's contribution, it was originally introduced back in November 2006. So the Better Access initiative introduced education and training for the mental health workforce. So it actually aimed to encourage a lot of GPs to participate in the provision of the mental health services in hopes to improve access to psychiatrists and enhance the availability and affordability of psychological services provided by the psychologists, social workers and occupational therapists in private practice. So some of the changes include the new mental health treatment items that to better remunerate the GP, so the time to effectively manage and provide quality mental health care to patients. There's a new item for psychiatrist consultation with a new patient referred by GP, as well as the expanded rebates for the existing items related to patient assessment and preparation or review of the treatment plan to be carried out by the GP. And then there was new items for allied mental health, so psychological therapy for the eligible clinical psychologists, and then the focused psychological strategies for eligible psychologists, social workers and occupational therapists. So that link will take you to the original fact sheet on the Better Access Initiative, but we're going to look at those changes as well. So the expansion of this initiative has taken into account COVID-19. So the extension of these sessions allows patients to receive up to 10 individual allied health mental services, up to 10 group allied health mental services. And the expansion of the residential residents of aged care to provide a mechanism for a limited time for the review of that Better Access Initiative. And a lot of that came in the final report through the Productivity Commission into the Mental Health Inquiry. So the better access to psychiatrists, psychologists and GPs. So from December last year until June 2022, they've extended that original program. So where it was 10 individual and 10 group, that's actually been expanded to include the 20 individual therapy sessions now, where their general practitioner or psychiatrist determines that they would clinically benefit from an additional mental health support. This will ensure that the residents can access the initiative in the same way that people are accessing that initiative in the community. So as I said, eligible aged care residents can access up to 20 individual psychological services each calendar year. And there's a couple of things around the services in particular. So they can be delivered face-to-face in the aged care facilities, telehealth or in the practitioners' rooms. So that's from 10th of December till 30th of June 2022. So and that's got through telehealth until the 31st of December this year, and in the practitioners' consulting rooms until the 30th of June 2022. The other thing that they've added in, and we'll speak about that when we get to the temporary MBS items in particular, is that to add that additional support for practitioners that are going to be delivering face-to-face services. They've actually attached the Flagfall items in particular for these. So, and it's available for the first resident during that face-to-face attendance at the aged care facility. So which residents are eligible? So they have to have a diagnosed mental disorder, and the resident needs to actually benefit from structured multidisciplinary approach to management of their treatment. So just going to go on to the next one. Okay, so which practitioners can actually deliver the psychological services? So they can be provided through the psychological therapy services by eligible clinical psychologists, or the focused psychological strategies by eligible GPs, other medical practitioners, registered psychologists, social workers and occupational therapists. So which mental disorders? So the mental disorders in primary care. So mental disorder is a term used to describe a range of clinically diagnosable disorders that significantly interfere with an individual's cognitive, emotional, social abilities. So on the next slide, I'm just going to show you, but dementia, delirium, tobacco use disorder, and mental retardation are not regarded as mental disorders for the purpose of this initiative, but may coexist with mental disorders. So who is eligible? So as part of that Better Access initiative, the support for residents is available for residents that have been diagnosed with a mental disorder that would benefit from that structured, multidisciplinary approach to the management of their treatment. So I've actually got the list of the mental disorders on the next one. I've highlighted those ones that aren't included. So I've got the diagnostic and management guidelines for mental disorders in primary care. And you can see there I've just highlighted those ones that aren't included as part of that initiative. So mental health, so we're going to look at a little bit of a step-by-step of what the GPs and medical practitioners need to do to kind of get this referral and plan in place for their residents and patients. So as we said, from December last year until 30th of June next year, those items will be available for the recipients of the resident in the residential aged care facilities to actually support them in that mental and physical health that have been affected by COVID-19. So many of the patients that have received deconditioning may need the mental health psychological services, but they might also need some additional allied health services, and that's why we'll be looking at that in the third session. So to access, there's two ways to access the mental health support under this Better Access initiative. So the first one is through a mental health treatment plan by a GP or other medical practitioner. Option B is a psychiatrist assessment and management plan. Okay, so the resident will need one of these plans. So to access the support under this initiative, the aged care residents will require an approved mental health treatment plan that has been developed by their general practitioner or other medical practitioner or through the psychiatrist. So tonight we're going to look at the pathway for the GP. So they need that approved mental health treatment plan. And then once in place, the GP or other medical practitioner can provide a referral under that Better Access. Okay, so I'm going to show you a template as well, and I've actually got a link to that in the slides and at the end of the slides for this webinar. So the Better Access initiative has heaps of resources, and I'm going to show you the sample plan that can be downloaded and imported into your software as a hard copy or however you wish to kind of use that if you don't have one of the mental health treatment plans already. There's also other fact sheets there. So there's fact sheets for patients and residents, and then for the health professionals as well. I'm going to show you that mental health treatment plan now. And then there's actually heaps of links for frequently asked questions and guidelines. So if you haven't had a chance, then jump on and have a look at that Better Access initiative. I'm just going to pop this one on here. So you can see this is just on that Better Access, and there's a sample template there. So I'm just going to download it so you can see it. So this is the PDF version, but if you're using your software or you might already have one that you're happy to use. Just thought it was quite concise, just a nice 2-page plan. Okay, so once we've got the plan in place, what do we need to do next? So the next step will be to generate the referral. Okay, so I'm going to answer some of the frequently asked questions as we go, and some of these answers are just, listed in that first frequently asked questions and the fact sheet on the Better Access initiative. So one of the questions that they ask on there is, can a referral for Better Access services be used across multiple calendar years? And the answer is yes. So it's very similar to the EPC form that we use for allied health services under a care plan or Aboriginal and Torres Strait Islander health assessment. So if a resident is referred for a specific number of services and they don't use that full number of services by the end of the calendar year, they can continue to use that referral to access the remaining services in the next calendar year. If it's easier to just print a new one with the new year, you can do that as well. But they're just saying that you don't have to do a brand new one if there's still visits remaining. They've got an example there. So for a resident of an aged care facility referred for 6 services in 2021 and only used 4, they can continue to use the remaining 2 services up until June 2022. So what should be on the referral? We might need to make sure that we've got the patient's name, date of birth, address, the diagnosis, list of any current medications, and the number of sessions. So this is really important. If the number of sessions aren't kind of listed on there, it will probably be sent back or asked to kind of specify what's involved in that course of treatment. So the number of sessions is that initial course of treatment. So we've got our mental health treatment plan, we've got our referral with the number of sessions, and we can do up to 6 on that first referral. Okay, so where a practitioner, as I said, receives a referral that doesn't specify those number of sessions the aged care resident is being referred for, then they need to actually clarify that with the referring practitioner. So if you can, just include it in that initial referral. So as we said, for that first one, it's an initial maximum of 6. So how many sessions can a resident be referred for in a single referral? So when the GP prepares that mental health treatment plan, they can refer the resident for an initial course of up to 6 sessions. Okay, next bit. So that initial course of treatment can be completed by GPs, other medical practitioners, psychologists, social workers, and occupational therapists. So up until, that was by phone, but it's okay. There was a question on bulk billing with the aged care residents. So there's no requirement for practitioners to bulk bill aged care residents. So it is at the practitioner's discretion to determine the appropriate billing arrangement, noting aged care residents will only receive the rebate amount attached to the relevant item in the MBS. Okay, so the next bit is to actually review the mental health treatment plan. So once that initial course of treatment has been completed, the GP actually needs to review that initial mental health plan and consider if the resident would benefit from additional sessions. Okay, so following the completion of that initial course of treatment, the GP must undertake the review. So if they want, they can actually provide a referral for up to 4 more Better Access sessions before conducting another review. So it goes mental health plan, initial course of treatment with the up to 6 sessions, and then you must review, and then we can do the other 4 and then another review. So if the resident of an aged care facility already has had a review of their mental health treatment plan in the last 3 months, then the practitioner can't actually claim a review item for the patient to access the further sessions. So that's just around the claiming restrictions on the review items. So a practitioner, if they're referring the resident for a further course of treatment within the 3 months of a review, then you can actually claim one of those consultation items instead. Okay, step number 5, once the 10 sessions are complete, so the GP and other medical practitioner can actually provide a referral for up to 10 more sessions if clinically appropriate. So that way the residents can access up to 20 better access sessions per calendar year. Okay, so once the 10 sessions have been completed, the reviewing practitioner can provide a referral for up to 10 more, but it has to be clinically appropriate. If they've already had that review, then you won't be able to claim that review number if it's been done in the last 3 months, but you can use that consult number as well. Okay, we're going to go on to the MBS items now. So first we'll start off with the Flagfall items. So which MBS items can be used. So I do recommend, if you haven't seen it yet, the fact sheets that are being made available through the Medicare website in the download and fact sheet section. And it's got, you know, tables and, you know, pages of information there that you can access as well. And we've got the links there for you as well. So the Flagfall items are available. As we said, this is when face-to-face services are being delivered in the aged care facilities. So it's for the first resident, the GP number there is 5675, and then the other medical practitioners one is 4125, and then the allied mental health professionals, it's $40. Now, we've actually got some additional resources that can be accessed as well, just by clicking on to access some of those items. So we've got some free items that can be accessed. We've actually got billing sheets actually laid out in a digital format that you can just print off and use, or just to access and have a quick reference to look at that MBS item. It's also got the Flagfall items in the other MBS items that are not listed. Okay, and I'll show you those one by one in a sec. So if you want to access those, all you have to do is scan the QR code or click onto the CDM Plus website, and you can actually access those resources for free up until the end of June next year. Okay, so some of the sheets that are there, go back to that if anyone needs to scan it, but the first one we've got there is the GP mental health treatment numbers. Okay, and then we've got the face-to-face telehealth and phone, and then the same for the other medical practitioners. So they've got their own separate sheet as well. And then we've got the allied mental health. So we've got psychologists, the OT, social workers under those item numbers there in the separate Flagfall item. So I'm just going to move it back to that QR code if you need to scan that, and I'll show you separately if we need to as well. Was there any questions at this point of where we're at in the presentation?
There's nothing as yet, Jane.
Yeah, that's okay. I'm going to show a couple of resources if that's okay.
Yeah, absolutely.
So I'm going to show. So this is the fact sheet for the practitioners. So I've got a link there in the end of the webinar in the slides, and you'll get a copy of those. So that's from December last year. It just explains a lot of those changes that we've gone through tonight. So who's actually able to access those additional psychological services, who can provide them, and then what item numbers are involved. So if you want, you can access that and just print it off as well. They've set it out in like a table format at the end, based on the GPs, other medical practitioners, and then they break it down into the psychologists, occupational therapists, and then the social workers. So definitely have a look at that resource if you haven't had a chance to yet. The Better Access Treatment Plan template that we showed you before as well is a really good one. And then I just want to show you. is the Better Access page as well. So it's got more information about what's involved in the initiative, when the services kind of started, the extra support that they've put in place, and then the goals. So there's actually, you know, additional funds for like training of health professionals as well. So you can click in and open those other ones and have a look. And then there's the resource collection as well. I'll just show you those. So there's a fact sheet for patients, there's one for the health professionals, there's the treatment plan template that we had open before. There's things on guidelines for the telehealth and Better Access telehealth guidelines. So if you haven't seen any of those, I do recommend just a little bit of extra reading just to make sure you're aware of your of what's required and things as part of delivering those psychological services. And then, as I said, we've actually got those billing sheets that are available as well. So it's just in a PDF format. You can download those and print them off, and take it to the aged care facility if you need to. And that also includes ones for the other medical practitioners. And then we've got one for the allied mental health providers as well. So it just makes it easy. There's so many item numbers now to remember. It's just a bit trickier. So sometimes it's easier to just have a quick glance and be able to do that. So you're able to access those resources for free. And I think that was the last one on mine. Done that one. And no questions?
No, there's been no questions. Please feel free to pop them in the chat box though, guys, if you do have questions.
Just going to open up the latest fact sheet as well. So that's just straight from the Medicare site, just the latest in the July, the COVID-19 temporary MBS telehealth services. So it's so many new numbers, it's really hard to remember them all. I'm just going to go right to the end on there. So I've got the links there with the more information. So any of those reports, any of the additional resources that we spoke about, you can access all of those, and the guys will provide a PDF of the slides as well. Kiara, is that right?
Yeah, I'll send everything out with your statement of attendance and the recording as well.
Yeah, perfect. So throughout each of those slides is the link on that particular slide as well. And then there's just the list of the resources at the end there as well.
Thanks, Jane.
It's okay.
Do we have any final questions for Jane, guys? Nothing as yet. I will just mention the third and final webinar in this series, like Jane mentioned, was Allied Health Support for Aged Care Residents during COVID-19. And this will be presented on Wednesday, the 21st of July at 7 p.m. So invitations for that webinar will go out later this week. So if you attended this one and would like to attend that one, we'll send that registration link out to you as well.